Good morning, classmates, professor. My name is Lorenzo Lott, and I'm going to be discussing the difference between the U.S. healthcare system and the Japanese healthcare system. I chose to discuss these two healthcare systems because, one, I am a U.S. citizen, and two, I actually reside in Japan, currently serving with our active duty military. The two systems are actually very similar, but also have quite a few differences. To begin, the U.S. healthcare system is a hybrid system. It's not really comparable to anything else out there as it stands currently. Versus the Japanese system is more of a universal healthcare system that guarantees quality care to all citizens and is primarily controlled by the Japanese government. With that being said, the Japanese government ensures that every citizen is entitled to some type of care, whether they have insurance or do not have insurance. And the quality care is to be maintained at the same level, whether they have insurance or not. One item of note, the Japanese government will cover up to 70% of all costs for citizens within its country. And the rest will be funded via insurances that the individual members maintain. One thing that the Japanese ensures is that their healthcare system will not put its citizens into a high cost of debt or high amounts of debt because they want to ensure that it's not financially straining on its individual citizens. Unlike the US system, where we don't really have a clearly defined method of ensuring that our system is not going to put people into a high debt category. One of the similarities of the Japanese program and the American program is that they have government subsidies, such as Medicare and Medi-Cal in the US, but their subsidy ensures that poor people can also get care. They pay nothing out of pocket, they just enroll in the program, and it's government funded to ensure that they receive quality of care. And the great part of it is that the doctors that they're utilizing are all within the same system and are hand selected by the members so that there is no difference in the care that they're given because the funding is ultimately similar and offered by the government of Japan. So some may argue that in the US, we offer the ability to choose our healthcare providers, which we do to a degree. But the Japanese system allows anybody within its system to select any provider that provides healthcare services within that country. Whereas the US, we have providers that are in the Medi-Cal, Medicare system that are the ones you can choose from and are kind of structured in a way to provide care for low income or no income personnel. And because they accept Medi-Cal and Medicaid, the care that's rendered is not necessarily the same quality of care that others get at other facilities that are more private or that are for profit and take other medical insurances like Blue Shield, Kaiser Permanente, etc. So how is Japan able to do this? Japan is able to do this by regulating the healthcare system aggressively. They minimize how many private, for-profit organizations offer healthcare services, but they also minimize how many private organizations own hospitals so that a bulk of the healthcare clinics or facilities within the country are primarily government funded, so that they are owned and operated, and they have a little more control of what goes on within those clinics and hospitals. This is contrary to the US, where a majority of healthcare facilities and clinics are owned by for-profit organizations and are designed to optimize revenue generation and profits. So, with that said, it makes it more competitive within that industry, but it also doesn't allow government to regulate as aggressively as they do in Japan, because everything is independently owned and operated and utilizes minimal government funds, but ultimately still gets government funding. Although the Japanese healthcare system or health insurance system is considered universal, that does not mean it comes free of cost. But the way the government funds this system is through taxation. So the citizens pay into this system via taxes and reap the benefits of a healthcare system that gives them quality care and is not grossly expensive or financially devastating. With the US being one of the largest countries spending the largest amount of money on healthcare, it is unique that we have not discovered the best system that works to optimize revenue generation while also regulating the industry so that quality care can be rendered to the population. Whereas Japan has figured out a system that works well for its citizens and that maintains a standard of healthcare to ensure population health, which is where we're trying to get today within the US.